So if you look at the FDA guidelines for dermal fillers, I mean, they outline these very strict, very exact usages.
Right, like they're approved for smoothing out your cheeks or, plumping your lip.
Exactly. Plumping lips, maybe rejuvenating the back of your hands. But right now, if you look at the stack of medical journals and clinic profiles we're diving into today, there is this booming multi-million-dollar industry that's injecting these exact same facial fillers into a place the FDA never explicitly approved them for.
The vulva.
Right. So today we're taking a deep dive into the below-the-belt aesthetics boom. It's an industry that has rapidly moved from completely taboo to totally mainstream. And our mission today is to answer one highly specific, highly intimate question submitted by you, the listener.
And it's a great question.
It really is. The question is, will labial fillers fix asymmetry of the outer lips?
That's a fantastic question, yeah. And it really forces us to look at how cosmetic medicine is actually evolving. But to answer it accurately for you, we have to establish the anatomical terrain right away.
Right, because people kind of mix it all up.
Exactly. When people talk colloquially about the labia, they often just lump everything together.
Yeah.
But in reality, we're talking about two very distinct anatomical structures. You have the outer lips and the inner lips. And the solutions for asymmetry, I mean, they vary drastically depending on exactly which tissue is involved.
And reading through these sources, it becomes incredibly clear that before we can even talk about how a syringe of filler fixes the problem, we need to understand what that terrain actually looks like. And more importantly, the underlying mechanics of what causes the asymmetry in the first place.
Yeah, totally. So let's define that terrain clearly. The vulva is made up of several parts, but the two we are focusing on are the labia majora and the labia minora.
Okay.
So the labia majora are the outer folds. They're the typically hair-bearing, fleshier, more substantial folds of tissue that surround and protect the vaginal opening.
Right.
And then the labia minora are the inner folds. These are hairless, highly vascularized, and they sit just inside the labia majora.
Okay, let's unpack this. If the labia majora are the fleshier outer folds, they are the ones carrying the actual volume. And when we talk about volume, we have to talk about what holds it all together. The sources point heavily to estrogen.
Yes, estrogen is key here.
But it's not just a reproductive hormone, right? Like, it acts as the actual architect for the tissue structure.
That's the perfect way to look at it. Estrogen regulates the fibroblasts in our bodies. And those are the cells responsible for producing collagen and elastin.
The building blocks.
Exactly. Collagen is the scaffolding, and elastin gives the tissue its snap, its
Right.
ability to bounce back. So when estrogen levels drop, which happens significantly during menopause or after childbirth or even during certain phases of extreme weight loss, that underlying scaffolding literally begins to degrade.
So it's a structural collapse, basically. Think of the labia majora, those outer lips, like a favorite plush pillow on your couch.
I love that analogy.
Right. Like when you first get it, it's firm, it's plump, and it provides a lot of cushion because the structural fibers inside are robust.
Yeah.
But as estrogen drops, or just with age and mechanical wear, it's like those fibers break down.
Yeah, the pillow loses its stuffing.
Exactly. The medical literature describes this as deflation. The outer lips lose their elasticity, the tissue thins out, and they start to sag because that collagen matrix is just, it's gone.
And what's fascinating here is how this deflation rarely happens perfectly evenly.
Right. Our bodies aren't perfectly symmetrical.
Not at all. Now, we should state clearly that minor asymmetry of both the inner and outer lips is completely natural. It is incredibly common right from birth. But as a woman ages, or as she experiences those massive hormonal shifts that dismantle the collagen scaffolding we just talked about, that underlying natural asymmetry often becomes much more pronounced.
So it gets more obvious.
Yeah. One side of the pillow might deflate significantly more than the other. Or, conversely, a woman might experience a condition where one side simply loses its volume while the other retains it, which creates a stark visual and physical imbalance.
And diving into the clinical notes from these aesthetic practices, I mean, this isn't just about someone looking in a mirror and wanting things to match for the sake of an idealized photograph.
No, not at all.
This localized deflation and the resulting asymmetry, it causes genuine physical discomfort.
It absolutely does, because the labia majora serve a really vital protective function. They're designed to act as a physical buffer for the more delicate inner anatomy.
Right.
When they thin out and deflate, they aren't providing that cushion anymore.
Yeah, the sources highlight women complaining of severe chafing during exercise. Just imagine trying to get through a 45-minute spin class or, going horseback riding, or even just wearing a tight pair of yoga pants and constantly feeling friction and irritation because that protective volume is just gone.
It sounds incredibly painful.
It does. Plus, this loss of volume and the resulting asymmetry can cause significant discomfort during sexual intimacy. The tissue is physically thinner, it's less cushioned, and therefore it's much more prone to micro tears and irritation.
Which logically brings us to the interventions being developed. Because if we know that the asymmetry and discomfort of the outer lips are fundamentally an issue of lost volume and degraded scaffolding.
The clinical question becomes, how do we safely replace that lost volume?
Exactly.
And that leads us to the concept of the labial puff, or labia majora augmentation.
Right. The labial puff relies on two main filler options to restore that volume. The first, and by far the most common in these outpatient settings, is the use of hyaluronic acid, or HA fillers.
The same stuff used in faces.
The exact same gel-like substances used in facial aesthetics. Our audience is probably familiar with brand names like Restylane or Juvederm.
Oh, sure.
But there are also newer, specific formulations like Novia Rose, which is designed specifically for the unique rheology or the flow and density of intimate tissue.
Here's where it gets really interesting, because I used to think of HA filler as just like literal putty. You inject it, it takes up space, and that's it.
A lot of people think that.
Right, but that's not how it works at all. Hyaluronic acid is a humectant. It's essentially a microscopic sponge.
Exactly. At a molecular level, a single molecule of hyaluronic acid can hold up to 1,000 times its own weight in water.
Wow. So when a practitioner injects this HA into the deflated outer lips, it isn't just acting as physical stuffing to instantly balance out the asymmetry.
No, it does much more.
Right, those tiny molecules start pulling surrounding hydration into the tissue. So you are adding structural volume, yes, but you are actively hydrating the vaginal mucosa, the mucous membranes that often become incredibly dry when estrogen drops.
It's essentially dual action treatment.
Right. It plumps to fix the asymmetry and stop the chafing, and it hydrates to alleviate the deeper tissue dryness. Plus, the physical presence of the filler actually stretches the remaining fibroblasts, which stimulates the body's natural collagen production in the area.
It's a beautifully synergistic mechanism. Now, the second option for volume restoration mentioned in the literature is autologous fat transfer.
Right, using your own fat.
Exactly. This is a much longer-lasting alternative to HA fillers, though it requires a bit more intervention. It involves a mini liposuction procedure where the surgeon harvests the patient's own fat, usually from the lower abdomen or the inner thighs.
Okay.
That fat is then placed in a centrifuge to be purified. The damaged cells and fluids are stripped away, and only the robust, healthy fat cells are carefully injected back into the labia majora.
The fat transfer makes sense for longevity, but what really stood out in the sources is the sheer convenience of the HA filler option. Because we aren't talking about going under general anesthesia in a hospital here.
No, not at all.
We are talking about a 15 to 30-minute outpatient procedure. You go into the doctor's office, they apply a highly concentrated topical numbing cream, they perform a few strategic injections using a microcannula or a very fine needle, and you literally walk out.
Yeah, it's very quick.
There's virtually no downtime. You might have some mild swelling as those HA molecules start pulling in water, or a little bruising for a few days, but you can go right back to your normal daily activities.
And that accessibility is a massive factor in why this specific industry is booming. So, to directly address the prompt that you, the listener, submitted, yes.
Yes, it works.
If the asymmetry of the outer lips is caused by unequal volume loss, deflation, or a lack of plumpness due to those structural breakdowns, labial fillers, specifically HA or fat transfer, are an excellent, highly effective, non-surgical tool to restore symmetry and that functional cushion.
But I have to push back a little on the idea that a syringe is a magic wand for all asymmetry.
Okay, let's hear it.
Let's think about the physics of this. If a patient comes in and their asymmetry isn't because one side is deflated, but because there is simply too much tissue, say they have an excessively long inner lip that is hanging down way past the outer lip, a filler won't help that at all, right?
No, it won't.
Because you can't fix an overabundance of skin by pumping more volume into the tissue next to it. You just end up with a bulky, protruding mess.
That is a critical distinction.
Yeah.
If we connect this to the bigger picture, it all comes down to a fundamental surgical principle of addition versus subtraction.
Okay.
Fillers, whether you are using hyaluronic acid or harvested fat, they only add volume. They plump. They inflate.
Right.
If the asymmetry you are dealing with is due to enlarged or uneven inner lips, the labia minora, or if there is severe sagging excess skin on the outer lips that has lost all of its elastic recoil, you don't need addition. You need subtraction.
And subtraction means we are leaving the world of 15-minute filler appointments and entering the world of surgery.
Precisely. That requires a surgical labiaplasty. When a surgeon is dealing with enlarged inner lips, they generally rely on two main surgical techniques to achieve symmetry. The first is the trim method, which is sometimes called edge excision.
But if I'm visualizing the trim method correctly, are they literally just cutting away the excess edge of the inner lip to make it shorter?
Yes, that's exactly what it is.
But doesn't that remove the natural, textured, often darker edge of the labia entirely? That seems like it would leave a very obvious straight surgical scar right where the natural anatomy should be.
You've hit on the exact criticism of the trim method within the plastic surgery community.
Oh, really?
Yeah. While it is technically easier for the surgeon to perform and it effectively reduces the length, it amputates the natural corrugated edge of the tissue.
Jeez.
This is exactly why the alternative, the wedge method, was developed and is often preferred by top-tier specialists.
Okay, so how does the wedge method solve that?
Well, instead of cutting off the border, the wedge method involves removing a V-shaped or pie-shaped wedge of tissue from the thicker central body of the inner lip.
Oh, I see.
Then the surgeon brings the top and bottom margins together and stitches them. The distinct advantage here is that it preserves the entire natural wrinkled outer edge of the labia. It merely shortens the overall length from the middle, which yields a much more natural-looking result that often doesn't look surgically altered once healed.
That makes perfect sense geometrically. But that permanent surgical reality brings us to some frankly terrifying details in the sources about what happens when this subtraction goes wrong.
Yeah, it can be severe.
Because we are talking about a very delicate, highly vascular area. The literature explicitly warns against going to a general gynecologist or a novice surgeon who isn't specifically board certified in plastic techniques. The sources say novice surgeons often commit the ultimate error, which is they over-resect.
Right, they cut too much off.
But why does that happen so often? Are they just, like, measuring wrong?
It's not usually a measurement error. It's actually a failure to understand the dynamic nature of the tissue. The tissue of the labia minora is incredibly springy and elastic.
Right.
So if a novice surgeon applies too much tension, like if they pull hard on the tissue while they're making their incision, the tissue stretches out. They make the cut, but once they let go, the remaining tissue violently retracts. Suddenly they realize they've removed far more than intended.
The amputation effect.
Exactly. It's devastating for the patient. And the reality presented in the clinical data is stark. At least 50% of the time, surgical reconstruction of a botched labiaplasty is simply impossible.
Wow.
Because once that highly vascular tissue is gone, you cannot just grow it back.
A 50% failure rate for reconstruction is a massive risk. Though, for the sophisticated audience out there, the sources do highlight some incredible, highly advanced reconstructive work being done for that other 50%.
Yes, there are some amazing techniques.
There's a specific mention of Dr. Gary Alter, a renowned specialist in Beverly Hills, who uses highly complex procedures to fix these botched results. Specifically, a VY reconstruction.
The VY flap is a masterclass in tissue engineering.
Right, because you can't just take a piece of skin from an arm and sew it onto the vulva. The tissue type is entirely different, and it wouldn't have a blood supply. So what Dr. Alter does, if a novice surgeon accidentally leaves some viable tissue up around the clitoral hood, he carefully cuts a V shape into that remaining tissue, but leaves the underlying blood vessels intact. This is called a pedicle.
Right.
He then slides that tissue down to where the amputated labia used to be and stitches it into a Y shape. He's literally rearranging the local vascular anatomy to rebuild the missing structure without ever severing its life support. It is brilliant.
It is brilliant, but it is also incredibly difficult, immensely time-consuming, and significantly more expensive than the original surgery.
Yeah, I bet.
This perfectly underscores why distinguishing between the inner and outer lips is so critical. That permanent risk of botching a surgical subtraction makes the non-surgical addition of volume via fillers look incredibly appealing.
Right.
Fillers offer a much safer first step for asymmetry, assuming it's an outer lip volume issue.
But, you know, non-surgical does not mean risk-free, especially when we look at what doctors are actually injecting into this highly vascular tissue.
Absolutely.
We really need to look at the FDA guidelines and the reality of off-label usage. Because it's not the Wild West out there, but there are definitely strict boundaries that reputable clinics adhere to.
This raises an important question about the regulatory landscape.
Mm.
As we touched on at the beginning, if you look at the FDA guidelines for dermal fillers, they are explicitly approved for the face and hands.
Right.
Using them for genital enhancement, like the labial puff, is entirely considered an off-label use. Now, off-label use is very common in medicine. It just means the physician is using an approved product for an unapproved anatomical area based on their clinical judgment.
And we have to highlight this aggressively because while off-label HA fillers are common, the FDA source is completely uncompromising on one specific material, which is injectable silicone.
Yes, very important.
The FDA issues a severe black box style warning stating that injectable silicone should never be used for body contouring or enhancement anywhere, period.
And the mechanism behind that danger is severe. Silicone does not integrate into the tissue like hyaluronic acid. It doesn't act like a sponge.
Right.
It is a permanent foreign synthetic. The body often attacks it, forming hard, painful granulomas around it. Worse, if silicone is accidentally injected into one of the many veins in the vulvar area, it won't dissolve.
Oh, no.
It travels through the vascular system. This can lead to an embolism, where the blood vessel gets entirely blocked, which can result in stroke, massive tissue death, or even death of the patient. Safe, reputable clinics are only using temporary hyaluronic acid fillers or the patient's own harvested fat. Silicone is an absolute hard no.
It is genuinely life and death. Now, even regarding the safe HA fillers, you need to understand the duration and the standard risks. Because HA is a naturally occurring substance in the body, your body naturally produces an enzyme called hyaluronidase that will eventually break it down and metabolize it. So the results aren't permanent.
They aren't. A standard HA filler might last 6 to 12 months in this highly mobile area.
Okay.
Highly cross-linked, concentrated formulations like the Nuivio Rose we discussed earlier might push that duration closer to 2 years because it takes the body's enzymes longer to break down the dense molecular bonds.
And there's also a semi-permanent option mentioned in the literature called Belafil, which utilizes a different mechanism entirely and can last up to 3 years. But regardless of the specific product, you are signing up for ongoing maintenance.
You are. And the standard side effects apply. You can expect bruising, swelling as the HA pulls in water, tenderness, and potentially small lumps as the filler settles into the tissue matrix.
Right.
The most severe, albeit very rare risk with HA fillers is vascular occlusion, leading to tissue necrosis. Just like with silicone, if the injector accidentally places the HA gel directly into an artery, it blocks the blood flow, and the downstream tissue starves and dies.
Yikes.
The advantage with HA, though, is that if a doctor spots this instantly, they can inject hyaluronidase to dissolve the filler and restore blood flow immediately. But this emphasizes exactly why intimate anatomy requires a highly trained, specialized provider who intimately understands the vascular roadmap.
Absolutely. Now, pulling back from the intense medical mechanics and looking at the entire stack of sources, there is a massive sociological tension woven through all this clinical data. Because at the end of the day, we are talking about reshaping genitalia.
It is a profoundly complex issue. The sources present a stark divide here. On one hand, medical advocates and the clinical data argue that correcting this anatomy is fundamentally about functional empowerment.
Right, the physical side.
We discussed the chafing, the pain during sex, the physical discomfort of riding a bike. Fixing those physical issues changes a person's daily life. It allows them to move freely and comfortably.
But on the other hand, sociological critics are looking at the explosion of these procedures and raising some serious red flags. Campaigns like the Labial Library argue the exact opposite.
Yes, they have a very different perspective.
Their stance is that the rising popularity of these procedures and the marketing of the designer vagina is actively pathologizing normal, natural diversity. The fear is that women are being pressured to meet an artificial media-driven, airbrushed standard. So the Labial Library actively works against this by publishing photos to normalize the vast, incredible diversity in natural vulva shapes, sizes, colors, and asymmetry.
It's a fundamental clash between pursuing personal physical comfort and resisting societal beauty pressures. The medical consensus remains clear. There is no single, scientifically defined, normal appearance for the labia. Diversity is the absolute standard.
Right.
The ethical friction arises when a patient seeks out surgery or fillers not to resolve actual physical discomfort, but because they have internalized the belief that their completely natural anatomy somehow fails to meet an arbitrary standard.
It really requires a deeply honest conversation between the patient and the provider to ensure the motivation is rooted in physical comfort, not external pressure.
Exactly. So what does this all mean for the listener who submitted this fascinating question? Let's distill everything we've unpacked down to the core takeaway.
The answer to your question is a conditional but highly enthusiastic yes. Labial fillers can effectively and safely fix asymmetry of the outer lips. If your asymmetry is caused by unequal volume loss, deflation, or age-related thinning of that collagen scaffolding, an HA filler or a fat transfer can beautifully restore that lost volume.
Yeah, it acts as a microscopic sponge to provide symmetry, functional cushion, and deep hydration.
However, the strict condition relies on your specific anatomy. Fillers only add volume. They cannot shrink the inner lips. They cannot tighten severely sagging outer skin.
Right.
If your asymmetry is caused by an overabundance of tissue rather than a lack of volume, fillers will not work. And a surgical reduction with all its associated permanent risks is the necessary medical path.
Whether you are driven by physical discomfort in a spin class or simply a desire for personal aesthetic confidence, the goal of these modern cosmetic advancements is to provide functional and emotional relief, offering you options that simply didn't exist a generation ago.
Yeah,
It's an entirely new frontier of self-care and medical aesthetics.
it truly is. Which leaves us with a final thought for you to mull over as we wrap up this deep dive into the sources.
Okay.
As non-surgical intimate procedures like the labial puff become as quick, routine, and accessible as getting a lunchtime facial or a lip flip, well, will this easy accessibility ultimately liberate us to finally fix the secret discomforts we've suffered with in silence for decades? Or will it subtly pressure us into applying face-level beauty standards and all the intense, exhaustive anxieties that come with them to the most hidden, intimate parts of our bodies?